Well, hello, everybody. Welcome to the Start or Sit podcast. I'm joined by Dr. Hawkins, orthopedic surgeon and sports medicine specialist. What we do here again is we're going to talk about the recent injuries or last week's injuries and talk about that player in the NFL. Is he going to start or sit because of that injury? And here we are going into week 11. Man, it's been a great season. Hey, Dr. Hawkins, I got to apologize right off the start here. I'm sorry about your Eagles the other night on Monday night. They're their first loss of the season. The 72 Miami Dolphins are rejoicing. You okay? You okay with that loss?
Yeah, I actually think, at the end of the day, most people would say, hey, we'll give up a game in the regular season if it means we're going to win the Super Bowl. So I'm sure that that's what everybody's hoping for. That being said, they've had a tough couple of weeks now holding up against teams that are running the ball on them. So hopefully it's just not a sign that they've figured out that defense or that they've gotten real thin and they're going to run into problems moving forward. So we'll see.
Yeah, it is that time of the year and time of the season where a lot of these players have previous injuries. They're banged up. I mean, it's a long season. It's an aggressive game. We've got some players that we're going to talk about today that have been kind of bumped around a little bit. But, talk about the Eagles and controversial play towards the end of the game. The tight end, Dallas Goedert, caught the ball, ended up being face masked on a tackle, lost the ball on a fumble. But alongside of all those kind of problems with just the play, he came up with what seems like a shoulder injury. Dallas Goedert, tight end, Eagles. He's on your team. What do you think?
Yeah, so he had one of those classic injuries where he came down real hard right on the point of his shoulder. So right laterally landing directly on the shoulder when he came down, all of his weight, a tackling guy, coming in on top of him. So all the indications is that he had a sprain of that acromioclavicular joint, what we like to call a separation of the shoulder. They're not talking about him being done for the season, so we assume it's a lower grade or lower severity of injury where you simply sprain those ligaments. But that's one of those injuries where if you've got a guy who's a receiver who relies on reaching up over his head, doing things where he extends his arms away from the body, that's a very painful injury and probably something he's going to sit going into this next week and then hopefully let those ligaments heal. And then, we've talked about it, I think, in the past where sometimes this is the one, if they really got to play him, they'll give him an injection at that joint going into the game to kind of numb it up to get through the game. But that doesn't allow you to heal. So, they're probably, hoping that this isn't that their season isn't turning around now. And they're probably going to want to preserve him for later in the season. So I think he's going to be a sit.
He's going to be a sit. And this AC joint separation, which is different than a shoulder dislocation. Again, you talked about this. This is really an injury that, there's not a lot of surgical options unless it's a significant AC separation and it's over a grade 3 or whatever. But again, we talk about biology here. It is a painful injury. He is a contact player. He's blocking, he's falling, he's getting tackled, catching balls over his head. And, you can irritate that and re-injure that joint, and it is painful. So he is sitting most likely. So there you go. That is Dallas Goedert, Philadelphia Eagles. He's going to sit this week. Let's talk about another former Philadelphia Eagle tight end, Zach Ertz, Arizona Cardinals tight end. He had what they're describing a significant damage to his knee based on an MRI they performed. He left the game. So, something's going on here with his knee. I think they're describing it almost season ending. You know anything about that?
Yeah. So the good news is his MRI came back and it does not appear that he has torn his ACL. I think that was the big concern. He kind of had a contact injury where the tackler came in onto the side of his knee and he did not want to weight bear on it, didn't want to get up, and they ended up taking him off in a cart with, a knee immobilizer on his knee. So obviously that gets everybody's attention. So when they're talking significant knee injury, they've been a little hush-hush about it, but I think we can extrapolate that this is probably a grade 2 MCL injury. So he has partially peeled off or partially torn the thick ligament on the inside half of the knee. When you look at how he got tackled, that would seem to be the one that took up the most stress from that type of an injury that isn't his ACL. So he is, unfortunately, he is a big part of, the Arizona Cardinals offense and had been doing well this year, even though as a team they've been struggling. So obviously that's going to be a big hit for the Cardinals having any type of a turnaround. They're already having problems with Kyler Murray. And so, when they say significant, they're talking almost in along the lines of he might be done for the season. So that's why I'm pretty sure we've got a grade 2, one that would typically be sort of 4 to 6 weeks, and we're at the point where 6 weeks just about puts us at the end of the season. So I'm pretty sure he's not going to have surgery, but he's going to be a sit, obviously.
Yeah, and he's going to be a sit, not just this week, but potentially with that MCL if it's a grade 2. Again, we talk biology, and that's a 4 to 6 week healing process. And just to get started, kind of practicing and stopping and starting cutting, twisting, turning, and all the things those athletes need to do. So, yeah, it's going to be a long healing process. Probably towards the end of the season, maybe an opportunity to play potentially, but keep an eye on him. Let's the tight end theme here. Let's talk about Gerald, Everett, LA Chargers. He exited with a groin injury, this old nagging groin injury, and that's a tough one. Those groins are tough injuries. Let's describe that injury.
Yeah, so it's back to that muscle control around the hip. So, typically we've talked about how when they describe it as a groin injury as opposed to a hamstring injury, it's usually either what's called the adductors, which are the muscles on the inside part of the thigh that stabilize it, or the hip flexors in the front. So, he's a big guy. He's a solid tight end, carries a fair amount of weight. He's at least like a 240, 250 kind of guy. So that's an injury where, he came out. I think he'll get into treatment this week. Again, we're getting into the time of year where some of these teams that are underperforming and don't have a chance, I think you're going to see those veterans take their time with trying to rehab and come back a little bit. So even though, a groin injury might be week to week, my guess is he's going to be like Darren Waller was last year for the Raiders. He's going to they'll say every week he's week to week, but I would bet he's going to be out a few weeks. So I think I would sit him.
Yeah, I would agree with you. That's Gerald Everett, LA Chargers tight end. He's a sit with a day-to-day groin injury. Here's a guy that's been kind of got the injury bug the last couple weeks. Kupp, LA Rams wide receiver. I read something where, the pass was out in front of him. He went to get it, came down obviously on his ankle. He has that high ankle sprain, and they're just saying the prognosis doesn't seem to be good for Kupp. He's on your team. Well, he's a producer, and high ankle sprain, tough one, huh?
Yeah, and the word came out that he is going to have surgery on this.
Oh, so, wow.
So he's got the surgeon that takes care of him is a guy named Neil Elatrash out in LA who works with a lot of the pro programs out there. And you could see Neil come out and see him on the field and take a look at him. So what they're planning on is that tightrope procedure where they're going to basically stabilize those two bones in the lower leg by essentially putting one or two basically fibers or heavy strength sutures between those two bones to kind of hold them anatomically close together so that the soft tissue can knit up and heal hopefully quicker. So usually when you see the tightrope procedure being done in these players, they're hoping it's going to actually shorten the recovery. The classic example was back when Tua was at Alabama, where he had back-to-back procedures just like this done and was back in several weeks. Now, Cooper relies, as you know, on super athleticism.
Oh, yeah.
And so, I think even with the surgery, he's going to be, a 4 to 6 week sit. I'm assuming they're going to put him on IR. But I think obviously they're going to try to be more aggressive rehabbing him and try to minimize the stiffness and the weakness that goes hand in hand with these injuries when you have to sit out for a while. And that's why they're doing that surgery. Yeah.
So just anatomically, just so our listeners can kind of visualize this, what's going on here is on a ankle sprain, that connective tissue that pulls or holds the fibula and tibia together, there's a torsion injury, and that becomes hypermobile. immobile or torn. And then they're going to stabilize that with this rope procedure you're describing. That's 4 to 6 weeks. And he's probably got a chronic ankle instability from previous injuries. Would that be fair to say? Because didn't he just have something with his ankle like a week ago, too?
Yeah, I think he did, and again, that may have been something that predisposed, but this was a definitely he got rolled up on pretty aggressively.
Mm-hmm.
So I don't think it was, I think it was definitely it might have been a new injury on top of an old injury, but I think it's unfortunately going to be keeping him out for a while.
Yeah. Ah, boy. Okay. Leonard Fournette, Tampa Bay Buccaneers running back. They put the hurt to the Seahawks in Munich, Germany. He had a fourth quarter injury. They're calling it a hip pointer. Boy, that's a painful one. Let's talk about a hip pointer and healing and recovery for Leonard Fournette.
Yeah, so the hip pointer, for those people who don't kind of anatomically know what's going on there, right below the level of your hip joint, the top part of the femur has sort of a bump or a muscle attachment that sticks out a little bit. It's kind of what gets in the way when you try to sit down next to somebody in a narrow seat. But anyway, that bump of bone, because it sticks out, if you get hit directly over that area, a lot of times you'll get a significant bruise of the muscle and the soft tissue over that area. So it's a very painful injury. It's one of those things why you see a lot of the football players with the large pads on the side of their hip to help prevent that. It usually will not keep somebody out if they're really motivated to play. But again, for a running back who's going to get run into and land on people, it could really limit his ability to play a lot during the game. So I could see him coming in and playing short yardage situations, trying to get it across the line of scrimmage. But I don't see him doing a lot of things where he's running out in space and might get sort of taken down from the side. So I think if you don't have another running back, I think you can play him and expect he might get some points for you, but I don't think he's going to be productive like he's been earlier this year. And going to the problems for the Seahawks, it clearly, it was great to see him play in Germany, but that's a huge time change coming from the West Coast to go to Germany. So, those poor guys were getting up at 6 a.m. or whatever, 4 a.m. getting up, starting a game at 6 a.m. So I think they were really hamstrung by that game location.
Yeah, and the good news is I think the NFL graciously gave both teams a bye. So for Leonard Fournette, he will have this week 11 with a bye to rest. Week 12, good possibility if he's on your team. Week 12, he'll go. That's what I'm kind of hearing you talk about. Is that correct?
Yep, that sounds exactly correct.
Perfect. Let's talk about Jeudy, Denver Broncos wide receiver. Again, Sunday, he left. It looks like he has an ankle sprain. He wasn't able to put any pressure on his leg. The assessment at this point in time is they're saying a muscle strain and an MRI, mild injury. So it must not be significant ligament damage, but just soft tissue on Jeudy.
Yeah, I think when they saw him leaving the field, I think the concern was because he kind of wouldn't put his heel down, was the concern that this was an Achilles injury. And that's obviously why they got the MRI. And evidently, they're describing muscle strain. So that's usually one of two things with that type of an injury. It's either a strain of the medial gastrocnemius, which is the muscle part of the Achilles up a little higher. And that's kind of the classic, like, hey, I felt a pull or a pop in my calf and have a lot of pain. That takes time. That's the biology one where the muscle has to knit together. The other possibility would be the deeper muscles in the deep posterior compartment of the leg, probably the most common being the posterior tibial. And so, with those injuries, it sounds like he's feeling better already, and with the MRI not showing a whole lot, I think he'll be on the mend quickly. However, as we talk about all the time with these explosive guys, I think he's probably going to be a sit this week, but hopefully back in 2 weeks. Okay,
Jeudy, Denver Broncos wide receiver, sit this week. That's week 11, most likely back week 12. Here's our final athlete we're going to talk about is Herbert, Chicago Bears running back. He sustained a hip injury, but that's all I have against the Lions. It was a 31-30 loss. Chicago Bears running back Herbert, hip injury. Do you have any thoughts on that?
Yeah, so they have made some comments that he is going to go on injured reserve. So that tells us it's a substantial one. They're talking about David Montgomery coming in and having the snaps ahead of him now. So, they've been a little hush-hush on the actual injury, but he's going to be a sit because of the fact that of the discussions of injured reserve for him. So that's a minimum of 4 weeks out.
IR is 4 weeks out. So Herbert, your running back from Chicago Bears, is out for 4 weeks, going on injured reserve. That's our podcast today. That's our players. And Dr. Hawkins, again, thank you for your time, your expertise. Again, you've been spot on. I've been following up on these players we talk about, and your batting average is good. And I'm going to wish you the best of luck with the Philadelphia Eagles. I think they'll get it together here. So.
Yeah, it sounds good, Shannon. Thank you very much.
Okay, take care. Yeah, you bet.